purpose of the Dentist Wellbeing Committee is to assist the dentists in the state of Maryland that may have problems with alcohol, drugs, depression, anxiety, any kind of mental health problem.
We are a committee of the Maryland State Dental Association. Anything that is causing a problem for a dentist and affecting their personal and professional lives, we're here to help with.
I have noticed that you have some people who have very small problems. In their minds, they're overwhelming problems, so they're really not small problems. However, they just need to be tweaked in the right direction as to what they need to do to improve their lives, improve their mental health, improve whatever, and then they go on their way. I have also seen dentists scared to death that they are going to lose their practice, lose their families, lose their license, and just drown. And they feel like they're in a deep hole and they have no way of getting out. And what the committee does is basically offers them a helping hand out, along with helping them get a plan so that they can move forward.
The Dentist Wellbeing Committee saved my life because I was a hopeless drug addict. I mean, I never thought that my life would ever mean anything. I lost my dental license, I lost my driver's license, I lost the respect of my family, and with the committee being on my side, my life changed 180 degrees. And, I've had my license back for over 10 years, and I haven't gotten my driver's license back too. And now, my family really loves me because they've seen how much I've changed my life.
Having been here 30 years, what's really meaningful is that seeing the people get into recovery and get their license back. That's really the most rewarding thing.
If someone is referred from the board and there is a licensure issue, say they've had their license suspended or revoked, once they're in our program and they're in compliance with what we recommend that they be doing, we can then advocate for them with the dental board and help them to get their license back or help them to get back into good standing with the board. We've developed a trust with our state dental board over a period of a number of years so that we've been able to be effective advocates for our participants. If someone comes to us of their own volition as a self-referral, and it can be a family member or spouse or employee or a colleague can refer them, even if they don't come of their own volition. As long as they don't come from the dental board, we consider that to be self-referred. And in that case, the board has no knowledge of them or their activities at all. They're kept completely anonymous.
We are a confidential organization whose sole purpose is to help other dentists. As a woman dentist, I understand where women can become completely overwhelmed trying to balance running a business, being a dentist, and also trying to take care of their families. And it can really end up causing a lot of stress, being pulled in 3 different directions at the same time. I understand where they're coming from, so I feel that I can give them my perspective and steer them in the right direction to get the help they need.
Well, dentistry is a very stressful occupation. No one really wants to go to the dentist. They kind of dread having dental treatment. So there is that feeling of pressure in a dental office. But there's also the fact that a dental practice is a business, and not many dentists are trained to manage a business. They're trained to treat patients, but the whole other side of that is the practice itself. And there's a lot involved in that, and there's a lot of learning, and there can be a lot of stress associated with that. Yeah, the committee can help with that stress and the consequences of that stress. Some people resort to unhealthy ways to deal with that stress, and that can take off and cause problems for them.
The process that someone goes through to get help from our committee is, first of all, they have to call us or they have to contact us somehow. They can either call our hotline number, in which case they will talk to Rob White, who is our clinical director, or they can call any committee member. And our contact information is listed on this website It's in our brochure, which is also posted on this website. So there's a number of different ways that they can find our contact information. But once they contact us, they will see Rob White for an assessment.
And if there was treatment needed, we'd refer them to treatment. And then we would determine what was needed and whether or not they needed our advocacy to keep their license.
You know, just about everybody is hesitant to contact a committee like ours. Healthcare professionals have a tendency to keep things to themselves and not seek help because, you know, we're the ones that are supposed to be helping other people, you know, not asking for help ourselves.
We want to get the message out that there's help available, that it's confidential, it's trustworthy, and that we're the legitimate advocates for the board. So if somebody's in trouble with the board, or before they get in trouble with the board, we're the ones that can advocate for them.
To anyone in the dental community that has an issue or knows of someone who does have an issue, whether it's personal or with work or whatever, please don't hesitate to give us a call. We are in a unique position to be able to help you. You probably think that you're the only one in the world who has this issue, and my gosh, what are they going to say? But I guarantee you, we have heard it all, we have been through it all, and we can help.
I love working with the committee. I've been chairman of this committee for over 17 years, and it never gets old. You know, the opportunity to help other people, help other dentists, to give back to my profession. I'm in recovery myself, and helping others is certainly a great help to my recovery. We have a saying that you have to give it away to keep it, and I have certainly found that to be true. And the more I work with others, especially with alcohol and drug issues, but also other issues, it definitely benefits me in my recovery. And I just love it. I'm very, very grateful to be a part of this committee and to have the privilege to do the work that we do.